Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Pharmacy Medicine. Today we will discuss about Rigor Mortis, which is continuation with the postmortem changes. Rigor Mortis by definition is a contraction, stiffening, shortening of all muscles of the body after molecular death. So in this state, there is contraction of muscles, all which becomes stiffened and shortened. Literally, rigor means rigidity and mortis means death. So thus rigor mortis is a postmortem stiffening rigidity of muscles in a dead body. Mechanism of rigor. In normal muscles, they usually consist of myosin and actin filaments. So these myosin actin filaments are usually present in the interdigitation form. At rest during life, this is minimal, but during contact state, they come closer to each other. This is assisted by ATP. So ATP is responsible for elasticity and plasticity of muscle. Dephosphorylation of ATP produces ADP and phosphate, which releases large amount of energy, which causes the muscle to contract. So actin and myosin filaments which are present using ATP, the muscles come close together and ATP is utilized. This lost ATP is resynthesized during life by breaking down the muscle's glycogen. So during life, muscles using ATP, they contract, and ATP, when it is utilizing ATP, the muscles get relaxed and ATP is resynthesized during life. But after that, resynthesization of ATP stops, existing ATP level starts decreasing slowly, and in actin myosin complex, they become more firm and hard due to muscle contraction. So since ATP is not present, so muscle starts getting contracted without presence of ATP to get muscle relaxed. So muscle become viscous and inextensible, leading to rigor mortis. So we should understand in active rigor mortis what happens is the ATP is required for relaxation of muscle because ATP is broken down to ADP and energy which lead to relaxation of muscle. But after that, since ATP is not synthesized, the muscle which is contracted, they get shortened, contracted and remain contracted after that, and just gets shortened up and gets stiffened, which leads to rigor mortis. Muscles involuntarily includes both involuntary and voluntary muscles. So sequence of muscles first includes the first involuntary muscles of the body, which is mainly first there is respiration and heart muscles. So for respiratory and heart muscles gets their first muscles are get rigor mortis starts there, then lead to the voluntary muscles. In voluntary muscles, it starts with the small muscles, that is eyelids, back of the neck, lower jaw, face, front of the neck, shoulders, chest, upper limbs, abdomen, lower limbs, and small muscles of hands and feet. So it takes from top to bottom, and this is called as the Nightingale's rule. So it starts from the eyes, then neck, then lower jaw, then face, then front of the neck, shoulders, chest, upper limbs, abdomen, lower limbs. Then lastly, the small muscles are hands or feet. So we should keep in mind that it goes from top to bottom. Lastly, the small muscles of hands and feet. So to test the rigor mortis, if it is established completely, we just first go for the eyelids, then hands and upper limbs, then lastly for tips of the fingers. If it is not able to extend, that indicates the rigor mortis is completely established. These are a few images of rigor mortis. Effects of rigor mortis: when in this state body becomes fixed and rigid, all joints becomes fixed and inextensible, so all becomes fixed. Hair may stand out, lead to goose skin appearance, that is puckered appearance. Testes may drawn up, semen may be void, heart may become empty because contraction of the heart, the blood which is present in the heart may be come out in the blood vessels. Reaction of muscle is usually acidic in nature due to accumulation of lactic acid. Passing of rigor. Rigor passes after autolysis and decomposition. So after autolysis or decomposition, when the bacteria start growing up, they starts degrading the muscle fibers and muscle get teared up and rigor passes off. Also, it can be passed after rigor is forcibly broken when the body is moved apart. Forceful extension of muscles can break the muscle fibers and lead to rigor to break off. Sequence of passing is of same as that of occurrence, that is first the small muscles of small muscles of the eyelids, then the chest, neck, chest, shoulders, upper limbs, the same frequency follows as it occurred. Time required for Rigor Mortis. It first appears at 2 to 3 hours, fully established at 12 hours, stays for 12 hours and passes for 12 hours. So we can remember is 12, 12, 12 and it will be easy to understand. So it starts with 2 to 3 hours. It takes about 12 hours to completely establish, remains for 12 hours and passes after 12 hours. So this is the way Rigor Mortis appears. It may be slight delay in different environment conditions. In summer, it may start 1 hour established in 12 hours and may pass off by 18 to 36 hours. In winter, it may start delayed for 2 to 3 hours, it may be delayed. Then it may be present for 12 to 18 hours and pass for 24 to 48 hours. Now coming to factors which affects Rigor Mortis. First is age. So in fetus or less than 7 months of age, there is no Rigor Mortis occurs because there is no glycogen present. So Rigor Mortis doesn't occur since glycogen is required for degradation and ATP formation and contraction. It's not for fetus less than 7 months. Rigor doesn't occur. Rigor may be present in full term and stillborn. Rigor appears early in children and elderly, less muscle mass present, so it occurs early in case of elderly as well as children. In sex, there is no difference. Condition of muscles in the sense, if the rigor appears slowly and stays longer in healthy individuals and relaxed muscles compared to if the body is worked out. In the sense, before that, if the person was in a state of assault, if he has been running and jogging, in that case, rigor appears early than compared to relaxed persons. Cause of death, in cases of immediate death, death associated with convulsions, it occurs immediately. In cases of chronic diseases, it appears early, and it is delayed in case of paralyzed muscles, extensive hemorrhages, and asphyxia cases. It is very delayed. Atmospheric temperatures, heat favors rigor. So, if the temperature of environment, if it is summer conditions, rigor occurs early. Cold delays rigor, and in cold environment, it gets delayed. Coming to medical importance of rigor mortis, it is a sign of death. So, if the rigor mortis is present, it is sure a sign of death. Times of death can be known. So, this is one of the rigor mortis is most of the time taken as the mode by which times of death can be recorded. So, if it is completely established, means if the fingertips also rigor present, then it indicates that more than 12 hours or 12 to 24 hours it is there. So it takes about 12 hours to establish completely. So more than 12 hours the time has been passed. It also indicates the position of the body at the time of death. So the time of death, how the person was laying down, the rigor mortis established and the position will be remain. If it is shifted, sometimes the one body parts may be become rigor mortis may be break on the one part. Now coming to differential diagnosis of rigor, in the sense few of the conditions which may stimulate like rigor mortis. In that includes core stiffening, heat stiffening, gas stiffening or petrified stiffening, caloric spasms. Cold stiffening, this is seen when the body is exposed to freezing temperatures for a reasonable period. The tissue becomes frozen and stiff. So when the body is exposed to extreme cold, it becomes stiff. It occurs due to freezing of body fluids, particularly at the tissue level and in the synovial sacs of the joint. So every fluid in the body gets iced, it's cold, they get freezed up and the body becomes stiff. So this may stimulate like falsely like rigor mortis. Also because of hardening of subcutaneous fat tissue, cold stiffening occurs. It can be differentiated with rigor mortis because in cold environment rigor doesn't appear early. It doesn't appear early. It is very delayed. So we can differentiate with rigor mortis and cold stiffening because of body temperature. If the body temperature is lower, it indicates the stiffening is because of cold. Heat stiffening, it occurs when the body is exposed more than 65 degrees centigrades. Rigidity is produced which is much more marked than the found in rigor mortis. This occurs because of coagulation of muscle proteins in which the flexors are affected more, giving it a pugilistic attitude. So pugilistic attitude in the sense the boxer's attitude where the flexors are flexed, hands and feet are flexed. So that is the pugilistic attitude which is seen in the heat stiffening of muscles. The stiffening remains until the muscles and ligaments are softened from the decomposition and normal aggression doesn't occur in these cases. So heat stiffening remains until the muscles are completely decomposed, and in these cases normally rigor mortis doesn't occur in heat stiffening. Can differentiate between rigor mortis by based on because heat stiffening is more intense than rigor. Rigor passes off, but heat stiffening is permanent. Other heat injuries are present on the body, and there is pugilistic attitude. That is the boxer hold. So how the boxer behaves, boxers flex their hands. That's the why. That's how the pugilistic attitude occurs in the heat stiffening. Next is a petrified gas stiffening. Gas stiffening occurs during putrefaction due to accumulation of gases in the tissues, which causes false rigidity. So in gas stiffening or putrefied gas stiffening, because of activation of bacteria, gas is produced which gets accumulated in the tissues and body becomes stiff. This can be differentiated because there is signs of decomposition is present, and if you press, there is cryptation hurt, means bursting of air bubbles can hurt. On incision, putrefactive rigidity putrefactive changes are seen. Rigidity disappears due to release of gases. Now coming to caloric spasm, also known as instantaneous rigor or cataleptic rigidity. This is a condition where a group of muscles which were in contraction or spasm at the time of death continue to be spasm even after death without a state of primary relaxation. So in previous video we discussed about changes in muscle. So when body goes for primary relaxation, but in caloric spasm, a group of muscles remain contracted even when after the death. So this is called as caloric spasm. Preconditions of caloric spasm. Usually in the sudden somatic death where the person dies suddenly, the caloric spasm is seen. In case of extreme activity at the time of death, extensive physical and emotional activity at the time of death is also one of the preconditions of formation of caloric spasm. Usually muscles involved in caloric spasm include single group of voluntary muscles, frequently of the hands. Occasionally the whole body may be also be affected. So mechanism of caloric spasm is unclear, but it may be neurogenic, and it may be also associated with the exhausted ATP in the affected muscles. Muscles involved usually include the hands and sometimes the whole body. No other conditions stimulate caloric spasm, so this is one of the conditions which doesn't have any precondition. It is the unique condition where only certain muscles gets involved. Great force is required to overcome the stiffness of caloric spasm compared to rigor mortis, which can be overcome by extending the muscles. It passes without interruption into rigor mortis and disappears when the rigor disappears. So caloric spasm occurs immediately after death, and it continues with the normal rigors, and it passes off after the rigor mortis disappears when the muscles get degraded by decomposition. Molecular importance of caloric spasm. Caloric spasm in case of drowning cases, sometimes the person may try to hold grass, or sometimes it may also hold the mud particles. So this one indicates that person was alive at the time of drowning. So the time of drowning, the person to get out of the water, he may try to hold the weeds or mud particles that may be tightly grasped in the hands because of caloric spasm. In case of suicide, the weapon remains tightly held in the hands even after death. That is also one of the indications that person may have committed a suicide, since after death the person cannot flex the muscles. So if the weapon is tightly held in the hands, it indicates the person was trying to commit suicide. In case of homicide, the hair or piece of cloth of the assailant remains tightly held in the hands of the victim. In a soldier killed in battlefield, the whole body may be stiff and caloric spasm may be present, and he may holding the weapon, which may be tightly grasped in his hand, which indicates the person was active at the time of death. These are my references. Thank you.